Scientists also confirm that regular intimacy effectively supports efforts to lower blood pressure, which means preventing the risk of preeclampsia. In fact, love during pregnancy is unsafe only in a few cases, such as women with a history of multiple miscarriages or threatened miscarriage, premature birth, vaginal bleeding, or cervical incompetence. Reproductive health experts list 5 reasons to encourage couples to be intimate during pregnancy. 1. Add joy. Interesting fact, many women admit that intimacy during this time brings more waves of excitement than before pregnancy. Is this true? Science has proven that increased estrogen levels during pregnancy lead to more abundant blood supply to the pelvic floor muscles, resulting in more sensitive sensations and stronger orgasms. Other hot locations throughout the body are also more sensitive, especially the 2 nipples. Orgasm itself is an impressive dose of endorphins, hormones known as natural drugs that have a sedative and relaxing effect, allowing the future mother to momentarily forget all the troubles. And more importantly, through the blood circulation, endorphins also reach the embryo. 2. The couple's feelings are more attached. Completely natural, the couple waiting to have a baby on one hand gets closer to each other on the other hand, distances themselves from each other. The expectant mother, especially in the first 3 months of pregnancy, often falls into a difficult mood, a phenomenon commonly expressed through erratic behavior and anger for no reason. Unable to explain all the unpleasant changes, the husband does not know how to help his wife, often doing anything can also be unjustly scolded. So he has to avoid and keep his distance. During sex, with all the efforts of touching, breathing, kissing, heat, and wonderful skin-to-skin contact, it works just like an invisible glue, bonding, generating empathy and allowing the people involved to understand each other without words. The oxytocin itself secreted by the couple's body during intimacy is a compound that bonds and deepens feelings. 3. Improve health. All physiological processes that take place during intimacy also have the effect of improving overall health. Firstly, sex and the physical effort associated with it, and the joy of orgasm, are miracle drugs that improve sleep quality. While pregnant women often have difficulty and lack of sleep, intimacy is really a necessary support activity. Next, science has proven that intimacy increases the concentration of antiglobulin IgA in the blood. This is an army of antibodies that allows people in the relationship to more effectively deal with attacks from viruses and pathogens. Thus, it can be said that sex improves the body's immunity and prevents infectious diseases, while avoiding flu and colds during pregnancy means protecting the health of the fetus. If the 2 factors mentioned above are not enough, endorphins released during intimacy also have a powerful pain-relieving effect, and allowing them to effectively relieve common discomforts that attack pregnant women, such as back pain, headaches, or hip pain. Scientists also confirm that regular intimacy effectively supports efforts to lower blood pressure, which means preventing the risk of preeclampsia. 4. Physical exercises for the body. Many studies have shown that sex can be classified as a particularly useful form of physical exercise for pregnant women because intimate activities activate most of the muscle system, improve the oxygen circulation to the cells, reduce spinal stiffness, and help burn excess energy from the future mother's 2-person diet. Sex is especially effective in improving blood circulation in the pelvic floor area, bringing health to the uterus, ensuring normal function of the placenta, and strengthening and enhancing bowel function. The stimulation from intimate activities also has a positive effect on bladder and urethral function. Pregnant women often complain about frequent urination, even suffering from urinary incontinence. Pelvic floor muscle contractions during sex have become a very effective preventive solution and medicine, completely free of charge. 5. Mothers can easily give birth. For women with healthy pregnancies that progress normally, intimacy between the 1st and 38th weeks of pregnancy does not increase the risk of premature birth. Moreover, sex can also help future mothers give birth more easily when the pregnancy is ripe. Evidence: prostaglandin, a compound related to the effort to promote labor, is present in semen, effectively supporting cervical dilation, helping mothers give birth quickly after the 38th week of pregnancy. If you find the video useful, please leave a comment below. Your interaction is a great motivation for me to continue sharing useful knowledge with everyone.